Hey, Alphanurses, I'm Licensure from alphanurseguy.com. This is 30 practice and class questions. Without delay, let's get started.
The nurse is assisting with a student assessment screening of sixth graders at the local grade school. A student presents with a back and spine, as in the following illustration. What is the nurse's best interpretation of this finding? 1. Dupuytren contracture. 2. Cole's fracture. 3. Scoliosis. 4. Lordosis. The correct answer is 3. Scoliosis. Rationale. Scoliosis occurs when the vertebrae rotate and begin to compress. The spinal column moves into a lateral curve. On assessment, findings include asymmetry of hip and shoulder height with prominent thoracic ribs and scapula on one side. Dupuytren contracture is a hand deformity with slow progressive thickening of the palmar fascia leading to flexion contracture of the fourth and fifth fingers. Cole's fracture occurs in the distal radius. Lordosis is a loss of lumbar curvature sometimes called flat back, which may also be present with scoliosis. The nurse is caring for a patient who had a dual energy X-ray absorptiometry scan and is now prescribed calcium with vitamin D twice a day. The patient asked the nurse the purpose of this drug. What is the nurse's best response? Select all that apply. 1. When your calcium and vitamin D levels are low, your risk for osteoporosis and osteomalacia increases. 2. When your vitamin D level is high, your bones release calcium to keep your blood calcium level in the normal range. 3. When your blood calcium is low, calcium is released from your bones, increasing your risk for fractures. 4. When blood calcium is normal, long bones are formed, increasing a person's height. 5. The extra calcium and vitamin D will help protect your bones from damage, such as fractures. 6. You can also get extra vitamin D by increasing your intake of beef and pork sources. The correct answers are 1. When your calcium and vitamin D levels are low, your risk for osteoporosis and osteomalacia increases. 3. When your blood calcium is low, calcium is released from your bones, increasing your risk for fractures. And 5. The extra calcium and vitamin D will help protect your bones from damage, such as fractures. Rationale. Vitamin D and its metabolites are produced in the body and transported in the blood to promote the absorption of calcium and phosphorus from the small intestine. There is a relationship between calcium and phosphorus, so that if a patient's phosphorus level is higher than normal, the calcium level will drop and vice versa. A decrease in the body's vitamin D level can result in osteomalacia, softening a bone, in an adult. When serum calcium levels are lowered, parathyroid hormone secretion increases and stimulates bone to promote osteoclastic activity and release calcium to the blood. PTH reduces the renal excretion of calcium and facilitates its absorption from the intestine. Sources of vitamin D include sunlight, fatty fish, and vitamin D-enriched foods. The nurse is preparing a discussion of musculoskeletal health maintenance for a group of older adults. Which key points would the nurse be sure to include? Select all that apply. 1. Be aware of and consume foods rich in calcium and vitamin D. 2. Wear hats and long sleeves to avoid sun exposure at all times. 3. Consider exercise with low impact to avoid risk for injury. 4. If you smoke, consider a smoking cessation program. 5. Excessive alcohol intake can interfere with vitamins and nutrients for bone growth. 6. Weight-bearing activities decrease the risk for osteoporosis. The correct answers are 1. Be aware of and consume foods rich in calcium and vitamin D. 3. Consider exercise with low impact to avoid risk for injury. 4. If you smoke, consider a smoking cessation program. 5. Excessive alcohol intake can interfere with vitamins and nutrients for bone growth. And 6. Weight-bearing activities decrease the risk for osteoporosis. Rationale. Many health problems of the musculoskeletal system can be prevented through health promotion strategies and avoidance of risky lifestyle behaviors. Weight-bearing activities, such as walking, can reduce risk factors for osteoporosis and maintain muscle strength. Young men are at the greatest risk for trauma related to motor vehicle crashes. Older adults are at the greatest risk for falls that result in fractures and soft tissue injury. High-impact sports, such as excessive jogging or running, can cause musculoskeletal injury to soft tissues and bone. Tobacco use slows the healing of musculoskeletal injuries. Excessive alcohol intake can decrease vitamins and nutrients a person needs for bone and muscle tissue growth. Hats and long sleeves are recommended to prevent sunburn, but the nurse would recommend 20 minutes of sun exposure several times a week for vitamin D, which contributes to bone health. The nurse is caring for a patient with osteoporosis who is at an increased risk for falls. Which intervention should the nurse delegate to the assistive personnel? 1. Identifying environmental factors that increase the risk for falls. 2. Monitoring gait, balance, and fatigue level with ambulation. 3. Collaborating with a physical therapist to provide the patient with a walker. 4. Assisting the patient with ambulation to the bathroom and in the halls. The correct answer is 4. Assisting the patient with ambulation to the bathroom and in the halls. Rationale. Assisting with activities of daily living, including assisting with ambulation to the bathroom and in the halls, is within the scope of the AP's practice. The other 3 interventions require additional educational preparation and are within the scope of practice of licensed nurses.
The parent of an infant with cystic fibrosis asks the nurse how to meet the child's increased nutritional needs. Which is the nurse's best suggestion? 1. You may need to increase the number of fresh fruits and vegetables you give your infant. 2. You may need to advance your infant's diet to whole cow's milk because it is higher in fat than formula. 3. You may need to change your infant to a higher calorie formula. 4. You may need to increase your infant's carbohydrate intake. The correct answer is 3. You may need to change your infant to a higher calorie formula. Often, infants with CF need to have a higher calorie formula to meet their nutritional needs. Infants may also be placed on hydrolysate formulas that contain medium-chain triglycerides. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The client has increased intracranial pressure, and the HCP orders a bolus of 0.5 grams per kilograms IV of 25% osmotic diuretic solution. The client weighs 165 pounds. How much medication should the nurse administer to the client? The correct answer is 37.5 grams. To determine this, first find the client's weight in kilograms. 165 pounds divided by 2.2, which equals to 75 kilograms. Then, multiply 0.5 grams by weight in kilograms. 0.5 multiplied by 75 kilograms, which equals to 37.5 grams. The client with a seizure disorder is prescribed phenytoin. Which statement indicates the client understands the medication teaching? 1. If my urine turns a reddish-brown color, I should call my doctor. 2. I should take my medication on an empty stomach. 3. I will use a soft bristled toothbrush to brush my teeth. 4. I may get a sore throat when taking this medication. The correct answer is 3. I will use a soft bristled toothbrush to brush my teeth. The client should use a soft bristled toothbrush to prevent gum irritation and bleeding. Gingival hyperplasia is a side effect of this medication. The client with a seizure disorder who is taking carbamazepine tells the clinic nurse, I am taking evening primrose oil for my premenstrual cramps, and it is really working. Which statement is the nurse's best response? 1. You should inform your HCP about taking this herb. 2. It is very dangerous to take both the herb and carbamazepine. 3. Herbs are natural substances, and I am glad it is helping your PMS. 4. Are you sure you should be taking herbs along with carbamazepine? The correct answer is 1. You should inform your HCP about taking this herb. Evening primrose oil may lower the seizure threshold, and the dose of carbamazepine, an anticonvulsant, may need to be modified. Therefore, the client should notify the HCP. Which data should the nurse assess for the client with a seizure disorder who is taking Valproate? 1. Creatinine and blood urea nitrogen levels. 2. White blood cell count. 3. Liver enzymes. 4. Red blood cell count. The correct answer is 3. Liver enzymes. Hepatotoxicity is one of the possible adverse reactions to Valproate, an anticonvulsant. Therefore, the liver enzymes should be monitored. The nurse is preparing to administer the following anticonvulsant medications. Which medication should the nurse question administering? 1. Carbamazepine to the client, who has a carbamazepine serum level of 8 micrograms per milliliter. 2. Clonazepam to the client, who has a clonazepam serum level of 60 nanograms per milliliter. 3. Phenytoin to the client who has a phenytoin serum level of 26 micrograms per milliliter. 4. Ethosuximide to the client who has an ethosuximide serum level of 45 micrograms per milliliter. The correct answer is 3. Phenytoin to the client who has a phenytoin serum level of 26 micrograms per milliliter. The therapeutic serum level of phenytoin, an anticonvulsant, is 10 to 20 micrograms per milliliter. Because the client's level is above that range, the nurse should question administering this medication. The client with a seizure disorder is prescribed fosphenytoin. Which interventions should the nurse discuss with the client? Select all that apply. 1. Instruct the client to wear a medic alert bracelet and carry identification. 2. Tell the client to not self-medicate with over-the-counter medications. 3. Encourage the client to decrease drinking of any type of alcohol. 4. Discuss the importance of maintaining good oral hygiene. 5. Explain the importance of maintaining adequate nutritional intake. The correct answers are 1. Instruct the client to wear a medic alert bracelet and carry identification. 2. Tell the client to not self-medicate with over-the-counter medications. And 5. Explain the importance of maintaining adequate nutritional intake. The client should wear a medic alert bracelet and carry identification so that an HCP and others possibly providing care know that the client has a seizure disorder. The client should not take any OTC medications without first consulting with the HCP or pharmacist because many medications interact with fosphenytoin, an anticonvulsant. The medication may cause anorexia, nausea, and vomiting. Therefore, the client should maintain an adequate nutritional intake. An antenatal client is informing the nurse of her prenatal signs and symptoms. Which of the following findings would the nurse determine are presumptive signs of pregnancy? Select all that apply. 1. Amenorrhea. 2. Breast tenderness. 3. Quickening. 4. Frequent urination. 5. Uterine growth. The correct answers are 1. Amenorrhea. 2. Breast tenderness. 3. Quickening. And 4. Frequent urination. There are 3 classifications of signs of pregnancy: presumptive, probable, and positive. Signs that are totally subjective or presumptive include amenorrhea, breast tenderness, quickening, and frequent urination. Signs that are objective but not totally absolute are termed probable and include alterations in uterine shape and size and softening of the cervix. Signs that are absolute or positive include hearing the fetal heartbeat, detecting fetal movement by a healthcare provider, and seeing ultrasound images of the fetal outline. The nurse is assessing the laboratory report of a 40-week gestation client. Which of the following values would the nurse expect to find elevated above pre-pregnancy levels? Select all that apply. 1. Glucose. 2. Fibrinogen. 3. Hematocrit. 4. Bilirubin. 5. White blood cells. The correct answers are 2. Fibrinogen and 5. White blood cells. Fibrinogen levels will be elevated slightly in a 40-week pregnant woman because coagulation factors like fibrinogen increase to help prevent excessive blood loss during delivery. A 40-week pregnant woman's white blood cell count will be elevated above normal as a means of protecting her body from infection. When analyzing the need for health teaching of a prenatal multigravida, the nurse should ask which of the following questions. 1. What are the ages of your children? 2. What is your marital status? 3. Do you ever drink alcohol? 4. Do you have any allergies? The correct answer is 3. Do you ever drink alcohol? All of the possible responses are questions that should be asked of a pregnant multigravida, but only one is related to the client's needs for health teaching. A woman whose prenatal weight was 105 pounds, weighs 109 pounds, at her 12-week visit. Which of the following comments by the nurse is appropriate at this time? 1. We expect you to gain about 1 pound per week, so your weight is a little low at this time. 2. Most women gain no weight during the first trimester, so I would suggest you eat fewer desserts for the next few weeks. 3. You entered the pregnancy well underweight, so we should check your diet to make sure you are getting the nutrients you need. 4. Your weight gain is exactly what we would expect it to be at this time. The correct answer is 4. Your weight gain is exactly what we would expect it to be at this time. For women who enter the pregnancy with a normal weight for height, the expected weight gain is 3 to 5 pounds for the entire first trimester and approximately 0.8 to 1 pound per week from weeks 13 to 40. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Because nausea and vomiting are such common complaints of pregnant women, the nurse provides anticipatory guidance to a 6-week gestation client by telling her to do which of the following? 1. Avoid eating greasy foods. 2. Drink orange juice before rising. 3. Consume 1 teaspoon of nutmeg each morning. 4. Eat 3 large meals plus a bedtime snack. The correct answer is 1. Avoid eating greasy foods. The stomach is extra sensitive during pregnancy, so the pregnant woman should try to avoid foods that will aggravate it even more. Most fatty, greasy, fried, or other generally unhealthy foods are not going to help settle the stomach. These make morning sickness worse. Saltine crackers should be eaten before rising. Drinking orange juice has not been recommended. Although consuming ginger may help to alleviate the nausea and vomiting of pregnancy, neither cinnamon nor nutmeg has been shown to alleviate the symptoms. It is recommended that mothers eat small, frequent meals throughout the day. A client enters the prenatal clinic. She states that she missed her period yesterday and used a home pregnancy test this morning. She states that the results were negative, but I still think I am pregnant. Which of the following statements would be appropriate for the nurse to make at this time? 1. Your period is probably just irregular. 2. We could do a blood test to check. 3. Home pregnancy test results are very accurate. 4. You should repeat the test in 1 week. The correct answer is 2. We could do a blood test to check. Because quantitative pregnancy tests measure the exact quantity of human chorionic gonadotropin in the bloodstream, they are more accurate than urine tests that simply measure whether or not the hormone is present in the urine. Similar to the urine tests on the market, qualitative serum tests detect whether or not the hormone is present, but they are still considered to be more accurate than urine tests. Agravida G1 P0000 is having her first prenatal physical examination. Which of the following assessments should the nurse inform the client that she will have that day? Select all that apply. 1. Pap smear. 2. Mammogram. 3. Glucose tolerance test. 4. Biophysical profile. 5. Complete blood count. The correct answers are 1. Pap smear and 5. Complete blood count. At the first prenatal visit, pregnant clients will undergo complete obstetrical and medical physical assessments. The assessments are performed to provide the healthcare practitioner with baseline data regarding the health and well-being of the woman, as well as to inform the healthcare practitioner of any medical problems that the mother has that might affect the pregnancy. A breast examination will be performed by the practitioner to assess for abnormalities, but since mammograms are potentially harm-producing X-rays, they are ordered only in emergent cases. A glucose assessment will likely be performed at the end of the second trimester. A biophysical profile may be done, but not until the third trimester. The nurse plans to provide anticipatory guidance to a 10 weeks pregnant client who is being seen in the prenatal clinic. Which of the following information should be a priority for the nurse to provide? 1. Pain management during labor. 2. Methods to relieve backaches. 3. Breastfeeding positions. 4. Characteristics of the newborn. The correct answer is 2. Methods to relieve backaches. This 10-week pregnant client will be entering the second trimester in a couple of weeks. As the uterine body grows, the client is likely to experience backaches. It is appropriate for the nurse to provide information about this possibility and ways to relieve them. A client asks the nurse what was meant when the physician told her she had a positive Chadwick sign. Which of the following information about the finding would be appropriate for the nurse to convey at this time? 1. It is a purplish stretch mark on your abdomen. 2. It means that you are having heart palpitations. 3. It is a bluish coloration of your cervix and vagina. 4. It means the doctor heard abnormal sounds when you breathed in. The correct answer is 3. It is a bluish coloration of your cervix and vagina. Chadwick's sign is a probable sign of pregnancy. The bluish coloration is a result of the increase in vascularization of the area in response to the high levels of circulating estrogen in the pregnant woman's system. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A client enters the prenatal clinic. She states that she believes she is pregnant. Which of the following hormone elevations will indicate a high probability that the client is pregnant? 1. Chorionic gonadotropin. 2. Oxytocin. 3. Prolactin. 4. Luteinizing hormone. The correct answer is 1. Chorionic gonadotropin. Human chorionic gonadotropin is produced by the fertilized egg. Its presence in the bloodstream signals the body to keep the corpus luteum alive. Until the placenta takes over the function of producing progesterone and estrogen, the corpus luteum produces the hormones that are essential to the maintenance of the pregnancy. Oxytocin is the hormone of labor. It is not measured as a sign of pregnancy. Prolactin is the hormone that stimulates lactogenesis immediately after delivery. It is not measured as a sign of pregnancy. Luteinizing hormone is the hormone that stimulates ovulation. It is not measured as a sign of pregnancy. A 16-year-old G1P0000 is being seen at her 10-week gestation visit. She tells the nurse that she felt the baby move that morning. Which of the following responses by the nurse is appropriate? 1. That is very exciting. The baby must be very healthy. 2. Would you please describe what you felt for me? 3. That is impossible. The baby is not big enough yet. 4. Would you please let me see if I can feel the baby? The correct answer is 2. Would you please describe what you felt for me? Quickening, or subjective fetal movement, occurs between 16 and 20 weeks gestation. At 10 weeks gestation, it would be impossible for the young woman to feel fetal movement. The nurse, therefore, should elicit more information from the teen to determine what she had felt. A 20-year-old client states that the at-home pregnancy test that she took this morning was positive. Which of the following comments by the nurse is appropriate at this time? 1. Congratulations, you and your family must be so happy. 2. Have you told the baby's father yet? 3. How do you feel about the results? 4. Please tell me when your last menstrual period was. The correct answer is 3. How do you feel about the results? Some pregnant women are happy about their pregnancy, some are sad, and still others are frightened. At the initial interview, it is essential that the nurse not assume that the woman will respond in any particular way. The nurse must ask open-ended questions to elicit the woman's feelings about the pregnancy. A client is in the 10th week of her pregnancy. Which of the following symptoms would the nurse expect the client to exhibit? Select all that apply. 1. Backache. 2. Urinary frequency. 3. Dyspnea on exertion. 4. Fatigue. 5. Diarrhea. The correct answers are 2. Urinary frequency, and 4. Fatigue. During the first trimester, the body undergoes a number of important changes. The embryo is developing, the hormones of the body are increasing, and the maternal blood supply is increasing. To accomplish each of the tasks, the body uses energy. The mother is fatigued not only because the body is undergoing great change, but also because the thyroid gland has not caught up with the increasing energy demands. In addition, because the organs are confined within the bony pelvis, the enlarging uterus prevents the bladder from expanding with large quantities of urine. As a result, the woman needs to urinate much more frequently than she did prior to becoming pregnant. The midwife has just palpated the fundal height at the location noted on the picture below. It is likely that the client is how many weeks pregnant? 1. 12 weeks. 2. 20 weeks. 3. 28 weeks. 4. 36 weeks. The correct answer is 1. 12 weeks. The client is likely 12 weeks pregnant. At 12 weeks, the fundal height is at the top of the symphysis. The fundal height is assessed at every prenatal visit. It is an easy, non-invasive means of assessing fetal growth. The nurse should know that the top of the fundus is at the level of the symphysis at the end of the first trimester. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. When assessing the psychological adjustment of an 8-week gravida, which of the following would the nurse expect to see signs of? 1. Ambivalence. 2. Depression. 3. Anxiety. 4. Ecstasy. The correct answer is 1. Ambivalence. It is common for women to be ambivalent about their pregnancy during the first trimester. Even women who stop taking birth control pills to become pregnant are often startled and ambivalent when they actually get pregnant. This is not pathological. The women usually slowly accept the pregnancy, and by 20 weeks gestation are happy and enthusiastic about the prospect of becoming a mother. How does the nurse interpret the laboratory analysis of a stool sample containing excessive amounts of azoturia and steatorrhea in a child with cystic fibrosis? The values indicate the child is 1. Not compliant with taking her vitamins. 2. Not compliant with taking her enzymes. 3. Eating too many foods high in fat. 4. Eating too many foods high in fiber. The correct answer is 2. Not compliant with taking her enzymes. If the child were not taking enzymes, the result would be a large amount of undigested food, azoturia, and steatorrhea in the stool. Pancreatic ducts in CF clients become clogged with thick mucus that blocks the flow of digestive enzymes from the pancreas to the duodenum. Therefore, clients must take digestive enzymes with all meals and snacks to aid in absorption of nutrients. Often, teens are non-compliant with their medication regimen because they want to be like their peers. Which would the nurse explain to parents about the inheritance of cystic fibrosis? 1. CF is an autosomal dominant trait passed on from the child's mother. 2. CF is an autosomal dominant trait passed on from the child's father. 3. The child of parents who are both carriers of the gene for CF has a 50% chance of acquiring CF. 4. The child of a mother who has CF and a father who is a carrier of the gene for CF has a 50% chance of acquiring CF. The correct answer is 4. The child of a mother who has CF and a father who is a carrier of the gene for CF has a 50% chance of acquiring CF. If the child is born to a parent with CF and the other parent is a carrier, the child has a 50% chance of acquiring the disease and a 50% chance of being a carrier of the disease. The parent of a 4-month-old with cystic fibrosis asks the nurse what time to begin the child's first chest physiotherapy each day. Which is the nurse's best response? 1. 30 minutes before feeding the child breakfast. 2. After deep suctioning the child each morning. 3. 30 minutes after feeding the child breakfast. 4. Only when the child has congestion or coughing. The correct answer is 1. 30 minutes before feeding the child breakfast. CPT should be done in the morning prior to feeding to avoid the risk of the child vomiting. When a nurse attempts to administer a medication to a patient, the patient refuses to take the medication because it causes diarrhea. The nurse provides teaching about the medication, but the patient continues adamantly to refuse the medication. Which should the nurse do first? 1. Document the patient's refusal to take the medication. 2. Discuss with a family member the need for the patient to take the medication. 3. Explain again to the patient the consequences of refusing to take the medication. 4. Notify the primary healthcare provider of the patient's refusal to take the medication. The correct answer is 1. Document the patient's refusal to take the medication. Withholding the medication and documenting the patient's refusal are the appropriate interventions. Patients have a right to refuse care. Discussing the situation with a family member without the patient's consent is a violation of confidentiality. The patient has been taught about the medication and adamantly refuses the medication. Further teaching at this time may be viewed by the patient as badgering. Notifying the primary healthcare provider eventually should be done, but it is not the priority at this time. You can get the NCLEX Mastery Bundle now, link is in the description, or you can get it at alphanurseguide.com.